Removing medical from a vial. The proper dosage of medication is withdrawn into a syringe using sterile technique. Gather equipment. Check the medication order against the original order in the medical record according to the facility policy. Know the action, special nursing considerations, safe dose ranges, purpose of administration, and adverse effects of the medications to be administered. Consider the appropriateness of medication for this patient. Perform hand hygiene. Then move the medication cart to the outside of the patient's room or prepare for administration in the medication area. Unlock the medication cart or drawer, enter passcode, or scan employee identification if required. Prepare medications for one patient at a time. Read the MAR and select the proper medication from the patient's medical drawer or unit stock. Compare the label with the MAR, check expiration dates, and perform calculations if necessary. Scan the barcodes of the package if required. Then remove the metal plastic cap on the vial that protects the rubber stopper. Then swab the rubber top with the antimicrobial swab and allow to dry. Remove the cap from the needle or blunt cannula by pulling it straight off. Touch off the plunger at the knob only. Draw back the amount of air, the syringe that is equal to the specific dose of medication to be withdrawn. Some facilities require use of filter needle when withdrawing premixed medications from multi-dose vials. Hold the vial on the flat surface, pierce the rubber stopper in the center with the needle tip, and inject the measured air into the space above the solution. Do not inject the air into the solution. Invert the vial, keep the tip of the needle or blunt cannula below the fluid level. Hold the vial on one hand and use the other to withdraw medication. Touch down the plunger and knob only. Draw up the prescribed amount of medication while holding the syringe vertically at the eye level. If any air bubbles accumulated in the syringe, tap the barrel of the syringe sharply and move the needle past the fluid into the air space to re-inject the air bubble into the vial. Return the needle tip on the solution and continue withdrawal of medication. After the correct dose is withdrawn, remove the needle from the vial and carefully replace the cap over the needle. If a filter needle has been used to draw up the medication, remove it and attach the appropriate administration device. Some facilities require changing the needle if one was used to withdraw the medication before administering the medication. Check the amount of medication in the syringe with the medication dose and discard any surplus. Recheck the label of the MAR. If a multi-dose vial is being used, label the vial with the date and time open, and store the vial containing the remaining medications according to the facility policy. Lock the medication cart before leaving it. Perform hand hygiene and proceed with the administration based on prescribed route.